I've always known that I've wanted to go into maternal-fetal medicine since my time in residency and really enjoyed taking care of complicated pregnant patients. I think it's a really unique time to be able to care for somebody during a pregnancy where they might have a lot of things going on. And it is such a privilege to be able to walk beside them, to be able to educate and empower patients, and hopefully give them something that they can take with even outside of pregnancy. I loved the interview day. Even though it was virtual, I could tell just how close all the faculty were. I could tell how great the training is, and that's been so true since the first day that I started. Everyone is really warm and welcoming while also still getting a really great breadth of MFM training with all of our rotations. There is tons of support no matter who you go to or which corner you're looking in. And so I would say from a clinical standpoint, the faculty are very supportive in making sure that you feel like you have all the resources you need to be making decisions, but they still give you great autonomy, especially when you're on the inpatient service. There's a lot of support from the research standpoint. I know I came in with some research ideas and have been able to kind of get those started. And everybody has ideas in terms of how to move things forward and helping fellows with their research projects. And then there's a lot of support from all of the other people in the department. So there's wonderful sonographers who are really great teachers. The nurses help you figure out how to be able to manage your clinic and help take care of your clinic patients. And you really get support from all areas of the department, which is really great. We have faculty who specialize in critical care and complex obstetric surgery. We have faculty that focus on hypertension in pregnancy and post-pregnancy. And so having faculty that all have their own little area of specialties while they also all practice bread and butter MFM is really great to be able to learn from their different areas of interest and see how they have built their practice as well within their own interests. My goals are to look at particular clinical outcomes specifically within Wisconsin that can help perhaps drive some policy change. And so right now working on trying to look at different rates of maternal morbidity across the state of Wisconsin, knowing that we've had some policy changes in the last year and working on postpartum Medicaid extension. And so hoping to have some clinical research and clinical outcomes that can help inform some policy changes that can improve healthcare access and overall maternal health in Wisconsin. I might be biased because I grew up here, so I'm very happy to be home, but I love Madison. I think no matter what season of the year it is, there's always things to do outside. You have access to the lakes, you can go cross-country skiing in the winter. It's just really a great city with a really great food scene and fun things to do on the weekend with sporting events all the time. It's really a great city to live in. I think the best part of being a fellow is feeling like I have my own patients that I'm fully responsible for. All of the fellows have their own clinic and their own panel of patients that we take care of with our wonderful nurse practitioners and physician assistants, and being able to really make relationships with these patients and walk with them through their whole pregnancy, which sometimes you don't get as a resident, has been really rewarding, and I've really enjoyed that part. I'm still very early on, but I think it's going to prepare me in a way to practice anywhere within any area within MFM, both from being a bread and butter MFM, doing both maternal and fetal sides, to also specializing in one of those areas if I decide to later in fellowship. But I feel pretty comfortable and confident that I will be ready to practice wherever I want to in the future. I think one of the most important things is that while you are a trainee and you will always be learning, that your voice and your opinion and your wellness will matter here.